Hi, my name's Jed Swinton. I'm a nurse. I've been a nurse for about 30 years. I have just seen Matt Hancocks reply to Shaun Lintern's question around NHS staff pay, particularly after COVID. I would like to show you some information from the NHS Pay Review Body 33rd report, which the government are already aware of, and also I would like to point out how this fallacy that nurses have had an inflation-busting pay rise is incorrect. So let's start with the NHS Pay Review Body 33rd report in 2020 from July, which rightly acknowledges the increase in funding from the Treasury to the NHS. As with most things, it's not just a case of throwing money at the problem. And this was recognised in the same report by the National Audit Office, where their conclusion was there will continue to be a risk that the NHS would be unable to use the extra funding from the long-term settlement optimally because of staffing shortages. And this is because you can't buy experience. It takes time to train, educate, and to skill experienced clinical staff. The level of vacancies in the NHS workforce as a whole has remained high, and this has implications in terms of additional working hours, increased use of bank and agency, increased sickness because of stress and burnout, poor staff health, and risking retention. In fact, the CQC concluded that the workforce challenges continue to affect delivery of health and social care in all sectors. Issues include staff turnover, and that the staff shortages could further increase the strain on the workforce. So where are we right now? Well, in a recent survey by the Royal College of Nursing with a sample group of 42,000, a third of nursing staff are thinking they're leaving their profession. And the main reason for thinking about leaving, across the board, overwhelmingly pay. There is also some elements of the way staff have been treated during the pandemic, lack of management support, and crucially, low staffing levels. The one factor that would make these staff would feel more valued would be improved pay, improved staffing levels, and safer working conditions with the ability to deliver excellent patient care. So, my story. So I've been a nurse for 30 years. I've been at the top of my grade as a clinical nurse specialist for the past 15. And whilst Matt and Boris will point to an inflation-busting pay rise, that's actually a fallacy. So, as you can see here on this graph, there are two lines. The top line, the blue, is the rate of inflation for the last 10 years. And that's CPI inflation, which is the lower of the two. The orange line is my increase in pay over the last 10 years, which, as you can see there, leaves me with a deficit, when you work it out, of about 20% in real terms reduction. There you have it. There's the information I wanted to share with you. You'll see that over the last 10 years, nursing pay has not kept up with inflation, and that leads to a reduction in real terms take-home money by around about 20% for me personally. Throughout the pandemic, the public have been absolutely fantastic in expressing their support for key workers and for nurses. So if you clapped us, could you now please back us and send a message to government that although they are aware of the risks and they are ignoring them, that they need to deal with nursing pay to aid recruitment, retention, and to maintain safe staffing levels for patient care. Please back the Royal College of Nursing campaign for fair pay for nursing. To do this, if you scan this code with your phone, it will take you to the Royal College of Nursing site, where you can fill in a web form to send a letter to your MP. Please share this video and encourage as many people as possible to get involved in this campaign. Thank you for taking the time to watch this video and to support your nurses and other key workers. I hope you all keep safe and share widely as you can. Thank you.